We're seeing slight improvement in COVID-19 numbers at the hospital, and there have been some new developments in boosters and vaccinations for children. I'm Rob Freelove, Chief Medical Officer and Senior Vice President, Salina Regional Health Center.
Well, Doctor, thank you so much for being on the show. We're going to be talking a little bit about COVID again. Let's start out talking about the numbers here locally.
Sure. We've seen a little bit of a dip in numbers here, at least through the hospital. We're testing a little bit less. We're seeing a few less positives than we were, 3-4 weeks ago. So that's good. We're actually, the last week, we've been running kind of 10 to 15 as far as inpatients, which is nice. We were up in that 15 to 20 and even above 20 range there for quite some time. So we've seen a little bit of improvement there, which is nice to see.
Let's talk about vaccinations here.
Sure. We're still, unfortunately, under 50% of Salina County that's vaccinated. I'd sure like to see that number get closer to that 70–80% range. The majority of our hospitalizations are still in unvaccinated individuals, and those that are vaccinated who get hospitalized are typically people who are older or have comorbid conditions, which really brings the importance of boosters into play.
Okay, let's talk about the boosters.
The boosters have now been approved across the board, so all vaccines, the three that are available in the U.S. have all been approved for boosters. The Pfizer and Moderna, anybody who's over age 65 should get it. Anybody who's over 50 who has a comorbid condition should get it. And those are the people that we are seeing that are vaccinated, fully vaccinated and getting hospitalized, are typically those older and have a comorbid condition. So I really want to encourage those people to get out and get a booster.
In our older population, actually, the percentage was higher, correct?
Yes, it was, yes.
Which is good. So they are up for their boosters.
They are. If you got one of the mRNA, the Pfizer or Moderna, and it's been more than 6 months since you got your second shot, you can get your third, you can get that booster. If you got Johnson & Johnson and it's been more than 2 months, you can get a booster. You can actually choose which one you get as your booster, so it doesn't have to be what you got the first time around. If you want to get something else to see if that gives you even a little more boost, that's acceptable. So you can essentially kind of mix and match now.
The recommendation for ages of vaccines has changed. Why don't you talk about that?
Yes, the CDC and FDA have actually approved the Pfizer vaccine for kids ages 5 to 11 now. So if you have a child in that age range, they are recommending that they get vaccinated. If you have questions about that, I would encourage you to talk to your child's doctor.
You talked about the little bit lower hospitalization numbers. That's also allowed us as the hospital to kind of open things up a little bit, correct?
Yes and no. We're still struggling with staffing,
okay.
Unfortunately. So some things have opened up a little bit in regards to surgeries, but we're still facing some struggles. We're probably going to need to get down and consistently be in single digits before we're going to be able to open up very much.
Thank you so much for some great information. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.